everyone. I just wanted to jump on and sort of give you guys an update on our Together for India fundraiser that we've been doing with Give India, Nick and I. While the situation on the ground in India has been improving, there's still obviously a lot of work that needs to be done, and that a lot that needs to continue in terms of healthcare, in terms of vaccinations. Our efforts for providing that kind of support on ground has been really amazing. Give India is doing some incredible work on the ground, and it really, you can see the difference. And we all have to contribute, and that's the only thing I feel sitting so far away from home that I can do tangibly. So we're very grateful for all of your contributions. Thank you so much for taking your time, your energy, donating your money to the cause. Nick and I are really grateful for your generous contributions so far, and I just wanted to give you a breakdown. We have been able to procure 800 oxygen concentrators and 500 oxygen cylinders. We've been able to provide food and dry rations to approximately 29,000 individuals across the country. We've been able to provide workforce support for vaccination centers, which will help 6,000 people get vaccinated. And also during the pandemic, there were a lot of children that were undergoing treatment for other things. We've also been able to provide 893 ration kits for families whose children suffer from cancer and are finding it hard to make ends meet. So thank you so much. It's you who's made all of this happen. But as I mentioned, there is a lot more that needs to be done. Which is why I wanted to share some very exciting news with all of you. And Melinda Gates Foundation has come forward to extend their support, and they are going to be matching donations so far up to $1 million. And this is amazing because this tremendous support is going to help us multiply the impact that we have already been having. I have Mr. Hari Menon here, who is the Country Director and Lead Policy and Government Relations South and Southeast Asia at the Bill and Melinda Gates Foundation, joining me here today for a quick chat. Hi, Hari, how are you?
Hi, Priyanka. I'm very well. Thank you so much for the opportunity to have this
chat.
Thank
you so much for your generous contribution, and on behalf of everyone that is going to be impacted with this contribution, please know that your foundation has always done incredible work, and we are very grateful to have your support.
Thank you, and we're really grateful to have your voice, the opportunity to partner with Give, and so many other philanthropists and everyday givers to try and make a difference at this time of great need, both within India and elsewhere. So
around the world,
the least we can do. Yeah, absolutely.
I mean, I feel like, we keep talking about the variants that are going around everywhere, the second wave, the third wave.
Mm-hmm.
I mean, if you think about it, to me, nobody's safe until everyone is safe. And we have to keep our, eye on the prize and make sure everyone is vaccinated and make sure that we can, make the world a safer place. And seeing what happened in India with the second wave, I think, it's going to be really important to have continued work on the ground. And of course, Give is doing some amazing work. I wanted to pivot to you guys, actually. Tell me, when it comes to the Gates Foundation, during this pandemic, you all have been extremely active as well. What are the core areas during this pandemic that you have focused on?
Yeah, no, thanks, Priyanka. I mean, like you said, no one's safe till everyone's safe. And that's really the lens we've been trying to apply as we've identified areas where, the foundation can contribute. I mean, again, it's a global pandemic. It's the first truly global development challenge, I guess, of our times. And it's taken all kinds of partnerships to try and make things work. So what we've tried to do is engage with country governments, with, multilateral donors, philanthropists, civil society organizations, to strengthen country efforts, aimed at, the early detection, testing, control, isolation and care. Then obviously looking at ways to expand access to vaccines, supporting the development as well as, manufacturing at low cost, so vaccines can get to people that need them most. And also looking at ways to mitigate the social and economic impacts of this pandemic on the most poor and vulnerable populations. So we've focused our efforts primarily in Africa and South Asia, That's kind of how we've approached it. We've looked at multiple levels in some way. So, we have some global partnerships, like the ACT accelerator that WHO and multiple countries set up, which is really looking at bringing together all of the global technical expertise to create, new tools to address COVID, therapeutics, testing,
Right.
vaccines. Then, we've also been actively involved with COVAX. I know you and Nick have also lent your voice to that, which is really looking at ways to make sure the equity gaps get addressed, even as we look at ways to get vaccines out. I mean, clearly there's a long way to go, but again, the appeal that folks like you and others have made. So, country governments step up and do the best they can to make sure that everyone that needs a vaccine has access to it. So we are actually doing our best to protect everyone. So, there are those kind of global partnerships. And then in India, we've looked at ways to complement, the government of India's efforts. We've really looked at what white spaces there might be where we can make, some kind of difference. And for us, a lot of that has focused on, the states of UP and Bihar, where we have large-scale health programs. So, we engage with the health ministry, with Niti Aayog, with the Department of Biotechnology, with ICMR to understand the government response efforts and look at ways where we can complement that. I mean, in the second wave, a lot of it has actually gone towards, therapeutic oxygen and making sure that's available in the states that need them the most. And, partnerships like the ACT Fund, Oxygen for India, PATH, GIVE, these have been some of the important ones. We've also looked at how to strengthen, the states' war rooms, command and control centers, so they can better monitor, track the pandemic, and look at ways to direct their response most effectively. We've also partnered to strengthen the procurement and availability of essential items to just strengthen care. In some states, we've looked at ways to expand field hospitals and temporary care infrastructure to deal with the surge. And of course, we've looked at ways to strengthen the manufacturing of vaccines. So in India, we had a partnership, through Gavi with Serum Institute of India, which is allowing the manufacture of both Covishield and Covovax vaccines with, incredible promise. Of course, the government has supported and led to the development of Covaxin from Bharat Biotech. And now there are some new promising vaccine candidates from companies like BioE and Zydus Cadila and others. So we are looking at what we can do to help support all of that. And a final, a very critical component, we are trying to understand what the impacts of COVID are on livelihoods, particularly of the poor and marginalized, most importantly, women, and looking at ways that, there can be a rebound from those impacts. So that's kind of, sum total of what we're doing. Right now, a lot of time and attention is going towards, supporting the government's campaign to get vaccines out across the country. I mean, India is now vaccinated well over 35 crore people, but a lot more needs to be done in the next 6 months. So, focusing on the communication side, generating demand,
Infrastructure.
Yeah, supporting, the human resources, the planning, logistics, all of that, doing it quite closely with the government and with partners like WHO, UNICEF, many other NGOs working on the ground. So it is a really all hands on deck effort in that sense. In terms of, financial contributions, incremental to what we already do in India, I think this has been about 225 crores we've committed over the last 15 months. And that's not taking into account the funding for, vaccine manufacturing, which was, about $300 million. So let me just stop there.
Well, I've always talked about the fact, like you said, it's a hands-on deck situation at the moment, and everyone has to contribute whatever is in their capacity. And the Gates Foundation has always had amazing leadership when it comes to philanthropy, and you're, like you just mentioned, stepping up when it is required the most. And it is such an upheaval, it is such an uphill task as a normal person just watching what is happening. It just feels to me like, is there light on the other side. Like some days you think about the fact that the waves that keep happening around the world, it's a very, very scary time, and it's wonderful to see the kind of work that you're doing on ground, and so many other NGOs and nonprofits are doing on the ground, and it makes you believe in not just science but also humanity. And that's all we can do at this point. Is it is really a hands-on deck situation. Um, I really congratulate you, but I wanted to ask you a question. You've worked with obviously Give for a very long time. I've worked with them on a lot of work that they do. Um, are there any specific areas you feel like this donation, specifically the one that you've made to Give, which will match the donations up to $1 million? Are there any specific areas that you want to see impact in India, especially because you're on the ground there? I'm not there. Like, what do you think is dire and urgent right now?
Yeah, no, thanks, Priyanka. So we worked with Give, and they're an excellent partner, and we've had discussions on a few areas of priority. One, of course, at this point, as the government of India, many you know leaders, the Prime Minister, business leaders, state leaders, everyone's indicated ramping up vaccination as a top priority. So we are hoping that some of the support will help increase the access and coverage of vaccines over the next few months. A second area that's important is, obviously there's been this influx of, oxygen concentrators, cylinders, plants in response to the needs in India, but making sure that there's capacity on the ground to keep that running, so the maintenance, appropriate deployment. So, this becomes an asset for the future. So that's a second area that we want to focus on. And for that, we are looking at the aspirational districts that the Niti Aayog has this program, looking across 112 districts where, progress can actually have a disproportionate impact on India's development indicators. So the aspirational districts are one arena, but also looking at states like Uttar Pradesh, Himachal, and Bihar. So that's another important area that we're looking at. I mentioned, the focus on livelihoods for the poor, marginalized, especially women. So looking at ways how those can be rebuilt to minimize the financial distress that families face. And a fourth one, very important, in light of the variants that we've seen fueling some of the surges across the world, is to expand the government's genomic sequencing capabilities. So, there is this network that the government of India has set up called INSACOG, which is now setting up a network, a national network of institutes that will collect samples and, sequence which variants are causing infection. So we have like an early detection for new variants. So those are the areas that we're hoping will be prioritized, through this funding that, we and many others are providing.
Well, that sounds absolutely like what is the need of the hour. And, that's eventually, it's really heartening to hear that, there are plans and there are big plans and, somebody's looking out for us. And that's a good feeling. Thank you so much, Hari, for taking the time. Thank you to the Gates Foundation for your extremely amazing contribution. And I would definitely like to thank everyone of you who's watching right now who has made a contribution or would like to make a contribution. Just everything will make a difference. The fight is not over, and until everyone is safe, no one is safe. If we want our families, our communities to not have this threat looming over us, we all have to stick together in this. And please get vaccinated. Make sure you and your family are vaccinated. If you can help people get vaccinated, let's make that happen as well. Thank you so much, Hari, for joining me, and thank you so much to the Gates Foundation and all of you.
Thanks so much, Priyanka. And I really want to thank both you and Nick for using your voice and your influence to bring attention to this crisis. You've done that both globally as well as in India, and I think it's really wonderful when people with your voice reach and influence, lend your voice to such efforts. And I think it's really wonderful. It really helps amplify both the cause and brings in a lot more attention, a lot more even funding like what we've been able to do with partners like Give, and ACT is also looking at, increase global and domestic giving, and it really makes a huge difference when people like you, contribute and decide to get engaged. So, I mean, I have a question for you, if that's okay. I mean, what motivated both you and Nick to get involved so actively, and you've made such a difference both for Give, but even on like engaging with UNICEF on vaccine donation. So just great to hear that.
Well, I think that we're citizens of the world, and both individually and collectively recognize that we've been given platforms that can help amplify messaging, that can help amplify knowledge and information. And at a time when nobody had information, nobody had access, and everyone is being scared, I think it was the responsibility of every single person to do whatever they can. And this is what we could do, and we're just grateful and that we have the platform to be able to help. Having seen so much selflessness from human beings during pandemic, to see our frontline workers, so many people in my family who are in medicine and they didn't come back home for weeks, because they were just in the hospital, to see communities coming together for each other, neighborhoods coming together for each other. It's like everyone played a part in helping, and that's the least we can do. So we're just very grateful giving. I mean, it as much as this was such a difficult time, it gave me renewed hope in humanity as well.
Thank you very much for all that you've done.
Of course, thank you. Thank you so much, and thank you, everybody. And let's keep fighting this fight, because no one's safe until everyone is safe.
Absolutely. Thank you.